All right. Good morning, good afternoon, and good evening to everyone who has joined. I'd like to welcome you to this most recent event in the GHSA Lessons Observed Webinar series, the GLOW series. Today, I am delighted to introduce a panel organized by the AMR Antimicrobial Resistance Action Package, or APP1, on cross-border collaborative approaches to address microbial resistance. We have two excellent panels. I just want to tell you today that there will be two ways for you to participate in this discussion when we get to the question and answer periods after each panel. One way is to place your interventions in the chat. The second is to use the raise hand function, which you can find in the bar at the bottom of your screen, and you may make a verbal intervention. I would ask, because this is interactive, to please be sure that you have muted your microphone unless you're a presenter or actively asking a question. With that, I would like to notify you that we do plan to record this, this presentation today for those who are unable to join, and just want to let you know that the purpose of that recording will be to share with those who have expressed interest in this issue through GHSA and are not able to join today. With that, I would like to introduce our first panel. Our first panel will be Dr. Annette Hoth and Dr. Sonia Lufmark. I apologize if I murder. This is Sonia. Dr. Sonia Lufmark-Berentz from the Unit for Antibiotic and Infection Control at the Public Health Agency of Sweden.
So I will start by sharing our screen. Okay, can you see the presentation now? Lovely. So thank you for introducing us, and also thanks for the organizers for giving us this platform to talk. Sorry?
Apologies.
Okay, you can't see it. Okay. Oh, I will. Let's do a try again.
Now we can see it. Thank you.
Oh, that's lovely. Thank you. It's amazing. After 7 years of working hybrid, it's still not working. So, but anyway, let me repeat my thank you to the organizers for giving us this platform to talk about this Nordic-Baltic collaboration, as well as our collaboration with Ukraine within the fields of antibiotics and infection prevention and control. So my name is Annette, and I will present the Baltic work together with my colleague Sonia, and we both work at the Public Health Agency of Sweden. So BALTOHOP, which is the name of the Nordic-Baltic collaboration, builds on long-standing contacts between the Nordic and the Baltic countries. So to my knowledge, the first formal collaboration on IPC and AMR between Sweden and the Baltic countries started already in 2004. So this particular project did not come out of nowhere. It's not like the Big Bang, for example. So the partner countries in BALTOHOP are Denmark, Norway, Sweden, Estonia, Latvia, and Lithuania. And just to explain to you where we are in the world, you can see on this slide a map of Europe, where we have the participating countries within this blue circle. And all countries are neighboring the Baltic Sea, with the exception of Norway, who's next to the North Sea. We had external funding for our work between 2023 and 2025 from the Nordic Council of Ministers through their funding agency Nordforsk, and we are currently keeping up the work with our national budgets. BALTOHOP stands for Baltic One Health, One Plan. So it's, in other words, a One Health project. The Swedish Board of Agriculture is, together with our agency, coordinating this work. So we really try to make it a One Health work in practice, not only on paper. This collaboration has 3 focus areas. One on the intersectoral coordinating mechanisms to support information sharing and collaboration between sectors on various aspects of AMR among relevant professionals. One on national action plan implementation, with the idea that by empowering the public health and veterinary and food services, the likelihood of reaching the aims within each country's national action plan that increases. And then a third area, that's providing skills and tools for responsible use of antibiotics for the professionals within the human and the animal sectors. Since the purpose of the work is to build capacity and to develop and support collaborative processes, we aim at having as many on-site meetings and workshops as possible. And of course, that is facilitated by the fact that we are regionally or geographically, I should say, very close. At the start of the BALTOHOP, we did an initial mapping exercise to identify the prioritized activities and possible synergies. And then also in the various tasks that we have defined, we work quite independently. Where, for example, colleagues in Denmark may work on one particular thing with one partner country, while one organization in Sweden works on something else with someone else. So I will now hand over to Sonja, who will talk a bit more about this work in detail.
Okay, great. So thank you, Annette. And to say something more in detail then about our Baltic-Nordic collaboration. In order to achieve this intersectoral collaboration in a One Health approach and also make some actions, the whole project is a lot about creating a forum for dialogues. We had plenty of on-site meetings, both with the Nordic and the Baltic. As Annette explained in the beginning, we together try to reach finding our similarities and differences and making priorities. In the start, we did have online introductions, and then we also had online follow-ups and all the meetings, but the main approach is the on-site meetings in each of the 3 Baltic countries throughout the years. And this really helped us building relationship and trust. It was also a way of setting the mutual goals and bringing up old ideas and new ideas and finding a way forward. And also a lot about exchanging of experiences in the different countries, as we are having similar AMR rates, we have similar sizes of countries and similar organizations, but there's still a lot of differences and trying to figure these out. And as mentioned, this is not something new, but it's a very a good experience in the way of finding the way of working together. So this also takes a lot of flexibility from everyone and a lot of persistence. We cannot give up. So we are also, as Annette mentioned, the project ended for funding in 2025, but we are persisting in keeping this alive. Next slide, please. So in achieving the collaboration and action, we found through the previous project called BALTOHOP, which was a Latvian-Swedish collaboration in a similar manner. They're also from the word, the name BALTOHOP also came from LATOHOP, Latvia One Health, One Plan. There it was also found that the basis for this work is the intersectoral coordinating mechanisms. And this is where we also decided to start in the BALTOHOP. And to make the intersectoral coordinating mechanisms functioning well, we really do need to make the needs assessment and mapping all the requirements, the legal requirements, and how the country is organized in working on AMR. Next steps would then be to find the structures and mandates and participants of this intersectoral coordinating mechanisms. And as I mentioned before, you really have to be persistent and flexible, because this takes time to understand and to really set the mandates and structures in place. It's not done in a week. And then finally, developing and also getting acceptance for the terms of reference. What is this intersectoral coordinating mechanism supposed to do? And what mandates will they have? And this, of course, will differ between the countries. And then in the end, the ICM is relating their work then to developing the national action plans or strategies. This was also a nice discussion. Is this a strategy or an action plan? Or do we have both? This was nice for all the countries, both the Nordic and the Baltic. How do we reach this approach? And of course, many already had something ongoing, but this was a nice process. Also, I say for Sweden, who is in the way of writing our own national action plan. And this takes a lot of work in also prioritization, which is hard, and but also very a fun approach to see what you actually need to do and what is actually valuable and will make the most effect, and where to get started. Some are low-hanging fruit. Maybe that's where you want to start to see some action. We also had very good support from WHO, especially when it came to monitoring and evaluation, which is an important part of making a national strategy or action plan. And of course, we want to emphasize this is continuous work. And the plans will, of course, be a few years, but then we need to reevaluate, midterm evaluate, and so on, and then continue. Next slide, please. And the third part that was mentioned by Annette, we have the intersectoral coordinating mechanisms, we have the national action plan or strategies. Then we also want to empower the profession. And in the BALTOHOP, we decided to do this a bit in the sectors. And for the human sector and animal sector, this was quite moving forward. There were lots of ideas from the different countries on what their needs were, and good collaboration. And I'm showing just this picture here on the side is, since we're from the Public Health Agency, we just want to say something about our own tools for antibiotic rounds for stewardship, which has been quite successful. So we were discussing if this could be something used. There were a lot of webinars and also on-site meetings. One aspect that did take and still is ongoing is how do we engage the environmental sector? I think this goes for all the countries, and we will see how this will continue. Next slide. So we did make some achievements, both in the Nordic and the Baltic, and these are some quotes from the countries, that there has been a strength in networks and knowledge sharing, enhanced cooperation, and contacts, of course. I mean, we, as Annette mentioned, we have been working for a long time with these partners, and we get to know each other even better in all these meetings, making the network even stronger. This is an improved foundation for future initiatives. We need to have it stronger and sustained. And then also, as I mentioned, the evaluation. How do we do the opportunities and challenges that comes in also for the different stakeholders and sectors? And some examples of better practices and some tools in the everyday life of the profession. So we're not only talking about the national top-down, but also the bottom-up approach. Next slide, please. And then finally, I just want to say something because it's BALTOHOP, so it's a focus on the Baltic countries. And some achievements that we did see was in Estonia, we saw a relaunch of the ICM, the intersectoral coordinating mechanisms involving all the key stakeholders. They also developed and adapted Estonia's first One Health AMR strategy. In Latvia, as I mentioned, we had the BALTOHOP, the Latvia One Health One Plan. And after that, they have also now made a new national action plan. And also within the BALTOHOP, they found the ICM framework, terms of reference developed and accepted, and also found a way of how they would how they will perform the leadership of this intersectoral coordinating mechanism, since there are several sectors to decide who will actually lead the work forward. And in Lithuania, we also had a renewed ICM assignment. It's been there since 2018. But to move forward and to get new energy into the work. they also initiated some development of their One Health Action Plan. And in Lithuania, it's been very strong, also on the tools, on these stewardship groups working on stewardship in the human health sectors. So with this, I just want to say before handing over to Annette that this is just a continued cooperation and national commitment, which is vital to ensure long-lasting impact. Thank you.
Thank you, Sonja. And so I will say a few words on next step and also summarize this work. So the next thing that will happen is that we will work closer with the EU joint action on AMR EU JAMRAI, as all BALTOHOP countries are also JAMRAI countries, partners, and there's a huge overlap with what we do within BALTOHOP and what we want to achieve within this EU joint action. So to summarize, so BALTOHOP builds on collaborative institutional and technical capacity within the public health and veterinary food sectors for AMR and IPC. The project also facilitates information sharing and collaboration between sectors on various aspects of AMR among relevant professionals in all partner countries, and also between so both within the country and between countries. And given the impact that AMR has on human health care and food production, AMR is a resilience and preparedness issue, and it really needs to be put high on the political agenda. I mean, obviously globally, and not the least in the region, especially during these geopolitically challenging times. Working closely together between neighboring countries strengthens the resilience of the region for AMR and for many other areas also outside the scope of health. So thank you very much for your attention. And before we hand over to our other colleagues here in Sweden, I guess we have time for a couple of questions if there are any. Thank you.
We do. Thank you so much. If you would like to ask any questions, you are more than welcome to submit a question or an intervention in the chat, or just to raise your hand and come on screen and ask directly. I would love to take the prerogative of the moderator to ask one question, please. One of the topics you discussed that I think is challenging in every region is this question of strategies, action plans, strategies, and implementation plans, and really sorting out what is an effective implementation plan I think you said it best. What is a strategy? What is an action plan or implementation plan? And how to think about those similarly across countries when you're talking about being able to collaborate and share feedback with each other. Could you speak a little bit more to some of those tools and the approach you took to that?
Well, thank you for the questions. I think this is in some way a little bit of a political question. Like, is it the governmental strategy? And then is it maybe the agency's action plan? So this also goes a little bit, some already find it difficult to have like one health action plan because the sectors are so different. It's a way of processing this and finding the mandates within this for the different sectors. And in that sense, some chose to have a One Health strategy, but then separate plans. So I think even if, I mean, the goal would be to have a One Health plan, I think, but it has to go through this process. It has to take a little time for each country to see this, but there's quite a lot of good tools also with WHO and working with these kind of networks in moving forward of finding your country's best approach in finding the structure, the mandate, the political versus the professions, and so on. But I think in any way, the importance of finding the collaboration, the intersectoral collaboration in somehow, and I know, like for example, in in the Nordic country, it's not, in Sweden it's very formalized, the ICM. But in other countries it's not. It's not that it's not there, but it's not formalized. And also for action plan, it's not like nothing is being done. It's just not formalized, but just to find your country's own prerequisites for making this happen. It's a process. Yeah.
And I would also like to add to that we must also be careful, to ensure together that we don't get stuck in producing documents, but it's more important that we actually do than what we call each thing. And it might not be the perfect national action plan, but at least it helps us to work.
No, absolutely. Thank you so much for the excellent presentation and for those points. If no one is going to make an intervention quickly, what I would suggest is that we go to our second session here, listen to those presentations, and then again have some time at the end for more discussion, if that's acceptable to everyone. All right. Wonderful. All right, we were going to, well, then proceed to our second discussion, which focuses on the Sweden-Ukraine collaboration on AMR. Our speakers will be Sarah Kosovich from the Unit for Antibiotic and Infection Control, again from the Public Health Agency of Sweden. And our second presenters, Maria Pronting and Marta Dumonska, will be presenting on behalf of REACT Europe, also based in Sweden. So, Sarah, if you would like to launch your presentation. Perfect, thank you. Oops, it disappeared.
Behöver du fälla ner?
Yes, now we can see it.
Okay, does this look good?
Okay. Perfect.
So good day to everyone, and thank you for the opportunity. I'll try to quickly take you through the AMR Contain Project, which is a Swedish-Ukrainian collaboration when it comes to antimicrobial resistance. A little bit of background when it comes to Ukraine and basically why did we start this collaboration, this project with the Ukrainian government, is the obvious pressure on the Ukrainian health system, which is under war, which really showcases different vulnerabilities and antimicrobial threats. And as in many systems that are in this situation, there are health system pressures such as overcrowded hospitals, disruptions in medical supply chains, which then lead to different vulnerabilities such as hospital-associated infections and the rise of those, as well as reduced capacity to maintain infection prevention and control. What we also saw from the Swedish perspective and in the conversation with our Ukrainian colleagues is that there is a limited availability of AMR diagnostics as well as data, which is needed to have decision-making processes as well as weak surveillance systems that can affect the timely outbreak detection and response. So this is basically one of the reasons why we decided to start an AMR project, because it's not just a Ukrainian issue, but it's also a health security issue that can affect us in the region as well as have a global impact. These are some of the challenges when it comes to Ukraine. So these are some of the WHO estimates that you can see in the first lines. So there are about 1.8 billion US in damages when it comes to strain on healthcare, as well as 23.1 billion US in needs when it comes to healthcare. And when you see the comparison on the healthcare expenditure per capita, you can see that Ukraine really fares quite low when it comes to World Bank estimates compared to EU average, as well as to Sweden, to some of the estimates that are being made. So this brings us to resource and funding gaps which then have an impact to limited laboratory infrastructure and diagnostic capacity. There are also shortages in antibiotics and IPC supplies, as well as limited funding for surveillance. So a little bit about the project. So this project, AMR Contain, is a financial support from the Swedish International Development Cooperation Agency, or the abbreviation SIDA, which is known, I guess, to two different actors. And it's a part of the National Board of Health and Welfare's mission to coordinate Swedish assistance to Ukraine in the health sector. This is the first Swedish project to receive funding within Sweden's reconstruction and reform cooperation with Ukraine, and it's focused on healthcare, medical services, and social policy. So the total program envelope from SIDA is 129.5 million crowns, which is about 14 million US dollars, I would say. And there is an allocation to the Public Health Agency of Sweden of 30 million crowns, which is about, I would say, 3 to 4 million US dollars. And this is for implementation during 2025 and 2027 year period. Here, I've tried to outline some of the project goals. Do you see the presentation?
It just leapt out of presentation mode. Yes.
Okay, let me try to do it again. I apologize.
No worries.
How about now?
Perfect.
Okay. So on the left, you can see the project goals. In the middle are the objectives, and on the right are long-term impacts and outcomes. And as you can see in the first row, all of our activities are in support to the Ukraine's 2024 National Action Plan on AMR, and all of our activities and objectives and impacts are bounded to that. We do also different objectives in this particular goal, such as data collection on AMR. I'll speak about these deliverables shortly. We try to increase the capacity to limit AMR, improve the national and regional AMR surveillance systems, as well as to strengthen IPC in healthcare, improve laboratory capacity, and enhance national surveillance and data systems. We also work to develop IPC guidelines to improve the laboratory capacity and surveillance equipment in place throughout the project duration, and also to work on treatment recommendations and stewardship initiatives. So this brings us to the long-term improvements, which are to strengthen the national IPC and stewardship programs, to increase compliance, to upgrade the lab infrastructure and analytic capacity, and to integrate EU regulations and align with the best practices, which is very important for Ukraine, as well as to meet the European standards, and not least to increase the preparedness for future health threats. These are some of the implementation activities, and you will hear more from our partner REACT on some of these, but just shortly. So it's support for data collection analysis for policy, it's prescription recommendations, which is tied to EU JAMRIDE 2 tools and digital e-learning, including Strama that was mentioned by my colleagues previously. It's also development and dissemination of national AMR strategies and IPC guidelines, training of healthcare professionals, study visits, as well as provision of lab equipment for AMR surveillance. We cannot do any of this without the support and synergy with our partners, and many of those are both in the country, but also in our neighboring states and a little bit further abroad. As I said, the alignment is with Ukraine's EU integration and ongoing health reforms, including their national action plan, and we do it with close collaboration with the national and regional counterparts. As I mentioned, we have different Swedish partners, the National Board of Health and Welfare, the Swedish International Development Cooperation Agency, REACT, the colleagues that will speak shortly after me. There are also two regions that we work with in Sweden, and as well as an organization called SweCare. There are different international partners that you can see on the right. So we work closely with Norway, we work with Germany, with Denmark, as well as other countries that work in Ukraine on the specific subject. And there are different regional and global collaborations, not least the Baltic-Nordic partners and others, including WHO Europe and the country office in Ukraine of WHO. These are just shortly some deliverables from last year. So we did a national point prevalence survey in 60 hospitals on hospital-acquired infections, on antimicrobial use and resistance. This was done together with the Public Health Center in Ukraine, which is based in Kiev. There is also work on procurement of lab material for this lab, different capacity building support for the regional laboratories. This includes the region of Lviv. We are also planning a study visit from the colleagues of the regional CDC in Lviv and the regional hospital based there. Different webinars have been executed together with SweCare on the topics relevant to AMR. And we also have a prototype of mobile applications as a tool for healthcare workers, which are developed in Ukrainian based on the Swedish experience when it comes to the Strama app. We also do a lot of translation of different key documents and guidelines in Ukrainian, and we all the time coordinate with the national and international actors on the topics. These are some future events that we anticipate in this year and next year. So again, to continue on the digital tools, to continue on supporting the stewardship activities and training programs, to procure laboratory equipment, as well as support the usability of IPC and other guidelines and translate materials. As I mentioned, there'll be a study visit happening in May to Sweden, as well as other activities that we foresee in 2027 that are tied to surveillance, to equipment, to IPC compliance, use of the data that we have collected, and integrate all of this into the AMR strategy. There are some risks. Definitely, this is a country that is in conflict. So there are disruptions when it comes to infrastructure, workforce, and supply chains. There is a limitation of finances. There is also variability in the implementation capacity, going from left to right in Ukraine. There are challenges in behavior change among prescribers. And the last but not least, there's a need for sustained political and institutional commitment, which can be quite challenging under these circumstances, definitely. So to conclude, AMR, as we can all agree, I guess, it's a global health security threat, is intensified by conflict settings, but we need to work further to strengthen surveillance, stewardship, and IPC, to also work on the partnerships that we have with the country, and also to have strategies for sustainable impact that will be a long-term investment, will be a national ownership, and that is aligned with international support. So this is our contribution to regional and to global health security. Thank you for your attention.
I think we will turn, if you can hold questions for one moment, to Maria and Marta first, and then we will have time for questions, if that's all right, Connie.
Perfect. Thank you. Let me just share the presentation. Do you see it?
Yes, it's perfect.
Perfect. Thank you. So first of all, good morning, good afternoon, and thank you to the organizers for giving the platform to this discussion, and also Sarah, thank you for giving such a great overview of the issue and of the collaboration. My name is Marta, and we have here also Maria, my colleague, who's the scientific coordinator at REACT. And I'm the project coordinator working with on the support to antimicrobial resistance mitigation in Ukraine as part of this broader collaboration. And I would like to start with sharing a little bit about what REACT is. So it's a now global network that was founded 20 years ago by some very passionate global health advocates and driven by the urgency to tackle and address the antibiotic resistance. It has grown into a global network and a global movement with nodes on 4 continents: in Ecuador, in India, in Zambia, and in Sweden, where we are hosted at Uppsala University. And over the years of our work, REACT has been active across sectors and continents on different levels to support governments and institutions doing advocacy to influence policy, for example, through policy development and national action plan implementations, to raise awareness and to drive innovative solutions to antibiotic resistance. But we've also worked a lot on within local projects through empowering community voices, and civil society groups. And that has been one of the big strengths of our organization, and it being so international. And for our project in Ukraine, this is quite new for REACT. This is part of REACT's Europe work. And for us, we're focused on 3 of the goals within Ukraine's National Action Plan. That being strengthening the infection prevention and control in healthcare facilities, raising awareness both among the general population, but also within the professional communities, and strengthening the human resources and education, as well as scientific exchange and research. The project for us started in 2025 in August, and we came to the project from the perspective of understanding the challenges in Ukraine, and hearing from them what they see as the priority. So it started with establishing partnerships in Ukraine, but also in Sweden, to better understand what is already happening. And by the end of the year, we did a lecture series on antibiotic resistance and infection prevention and control, which was done in collaboration, as a collaboration between REACT and a Ukrainian NGO, Zdorovi. They have been active in Ukraine for a while, and especially since 2022, they worked a lot as a humanitarian actor, but they also do quite a bit of education and advocacy. And they suggested tailoring it for nurses as the underappreciated profession. And so that's what we did. We had Swedish experts, and it was 3 lectures focusing on AMR as a global challenge, on tackling resistance in healthcare settings, and the role of nurses and what they can contribute and how they can work with this. And we did deliver it both in English, and they had an option to listen in Ukrainian. And we did gather a very large number. So over the 3 lectures, there were over 2,000 participants, which was quite impressive considering this was during the blackout times in Ukraine. So for 2026, we're building on that. And one of the biggest projects for us is developing a course on IPC and AMR. But we're also working in other areas to support the other National Action Plan goals. Within AMR and medical education, the goal is to establish it in the curriculum in a concrete way. And we've already had a lecture on AMR with the Ukrainian Medical Student Association. We're engaging with the civil society. We're planning to have a convening of the civil society actors that are either working with AMR already or are aspiring and are interested in the field and incorporating that into their work. And all of this we want to do sort of through the lens of working locally. Like Sarah said, you're collaborating with the regions and to deliver it to the hospitals and the regions in a more direct way. So I want to tell a little bit more on this course that I said is the biggest part of our work for this year. So it starts with a 2-month online course, and we decided to scale it down to about 50 nurses that are actively working across different specialties in Ukraine. And to make it as useful as possible, I would say, we want to bring in the combined expertise from Sweden, but also grounded in the reality of Ukraine by bringing in the experts from Ukraine. We're going to deliver through pre-recorded lectures and live discussions where we do as much case-based learning and as much practical learning as it is possible within the online format. And throughout the course, the participants are expected to develop a small-scale project that could be implemented in their facility. And by the end, 10 of the nurses are selected for a visit to Sweden to get the practical insights for some peer exchange. And they're also expected to then implement the small scale project that they develop throughout the course with our ongoing support. And I think what makes this important is that it focuses both on the knowledge and building their capacity, but also it's connected to the implementation in healthcare facilities. And we hope that this contributes to better IPC practices and sustainable, safer healthcare in Ukraine, but also on a global scale, a world free from untreatable infections. Thank you.
Thank you so much for yet another fantastic panel. I would like to express the thanks of the GHSA Committee on Advocacy and Communications. I know that there are questions already waiting, so I'm going to turn to Kwame, who has been patiently waiting to ask a question. And then I have a question as well about training. So Kwame, first to you.
Thank you very much, Julie. And I want to thank all the 3 presenters. Excellent presentation. I missed a bit of the first part, but the second and the third, very, very impressive. And it takes me back to 2011 when REACT, also started this catalytic activity in Ghana in developing our own national action plan. I'm looking at what they are doing in Ukraine, and very, very, very similar and very impactful. And we had opportunity to meet with, all those guys, and we are doing quite well as a country, in this one health network. And now we are on the verge of looking at NAP2. The first NAP was so good that even though it's expired, we're still implementing. So well done, and congratulations to REACT, on the work that they are doing across the globe. Now, my question is on they highlighted some of the challenges, with the work that they are doing with Ukraine. And what came into my mind, which I've seen also across most low middle income countries, Ukraine obviously is not because of the war, it's issues of sustainability and then addressing the challenges, that were highlighted. What are the plans in place to help? I mean, I know these educational activities, etc., but what are the plans in place to ensure that all these good works that have been initiated and ongoing, will be sustained and still impactful when REACT funding is not available? That's my first question. The second question is on the educational initiatives. I was wondering why the focus was on nurses, but not, looking at the entire spectrum of the health professionals, since in antimicrobial stewardship, you really need all the other partners and players, working together. That's my second question. And if you allow, my last one, Julie, Okay, thank you very much. I also know that University of New Mexico and Project ECHO is also supporting some of these education. Now, is there a way to synergize, the efforts for impact? Thank you. Thanks very much.
Thank you so much for the great questions. Maybe I will start, but I think both Annette, Sonia, and Sarah will add to what I say. First of all, I think it's great to synergize, and that's also what we've been trying to do with all of these activities, and I think overall with the broader collaboration. Regarding the target group, there has been quite an extensive discussion, and we came to the conclusion that we decide to target this specific group because it's quite a large group. It's around, I think, 230,000 nurses that are actively working in Ukraine. So there's a lot of ground to cover, and it has been quite an overlooked group while they're working directly with patients a lot, and there is a lot within AMR and IPC that within like knowledge and practice that needs to be addressed. It seemed like there hasn't been that many interventions directed at them. And I think also choosing a specific target group allows us to dial in a bit and talk not just about, AMR as an issue, but in a more practical way, how they can be engaged, what they can do. And with regards to sustainability, I think part of it is, for example, with bringing in the civil society organizations and the already existing structures, and instead of, building up something new from the ground, the goal is to support the existing infrastructure and just add on to what there already is. Yeah. Maybe Annette, I saw you were raising your hand as well.
So can I just add to the sustainable impact? I'm thinking a lot is about making sure we're in line with their endorsed National Action Plan from the Ministry of Health. That's where we are working because it has a political commitment. Another thing is the local we discussed, but the local ownership, making sure it's not something that, making sure that after we're out of funding, that it's still there. That's the whole process of making it useful and making sure it's also something they want and that it's owned by them on site. And another one is coordination with others that are maybe taking over after our funds are gone, to coordinate. And much of our work is building relationships with everyone in Ukraine, the WHO, all the actors that are there. There's so many international stakeholders in AMR, in Ukraine, in the different regions, and trying to find how we best find, as you mentioned, of course, the synergies. These are obvious, maybe, but I think these are very important to not forget. I'm just looking forward on building more of the relationships and finding the good coordinations. Thank you.
All right, we have a number of questions in the chat, and I also have a question. I am going to ask this quickly and then get to the questions in the chat. I apologize. One of the issues raised in the second panel and touched on, I think, in the first panel is the role in different countries, the roles that role-specific competencies and responsibilities of IPC and AMR professionals, which can vary from health system to health system. I had some questions about training for two questions, actually. The point that REACT is creating about raising awareness among nurses, I think is critical. I also wondered about awareness raising among hospital level clinical microbiology professionals. I admit that I come to this biased. I am a laboratorian. But I think in some of the countries where I have worked with AMR and IPC, one of the challenges has been staffing the clinical microbiology functions at the hospital level, in addition to identifying who is specifically responsible for IPC in different sectors, even within the same country sometimes. So I would love to hear a little bit about course development and approaches to include those clinical microbiology professionals in parallel with the nurses and other IPC professionals.
So maybe I can say something about that. So within our project, we are working closely with the Public Health Center, the laboratory in Ukraine, which is the reference laboratory. But also with in Sweden and Denmark, we have the European how to say reference lab, and they are also setting up courses. And there's been also together with UK, there's been training of microbiologists. And I agree. I mean, this is just the beginning, but making sure that the standards are according to EU, as we also our broader goal is the EU accession, right? So making sure they have also not only training, but the correct guidelines, etc., to follow. But I agree, and we're hoping to find in our regional collaboration and in hospital local collaboration, finding our integrated approach that we are, as you say, working with the lab. We need the microbiology, we need the stewardship, we need all of the different aspects and the nurses. And I can say also for the point prevalence study that was done by WHO country office together with Public Health Center in Ukraine, that our part has been to analyze and making the reports, and it's coming out soon. The report where you can see also that there is a lack of microbiology. There's also what causes these hospital-acquired infections, and it all connects this with the IPC. So I think you're absolutely right. The integrated approach might be difficult, but we need to really get started and make it feasible. Thank you.
Thank you so much. I'm going to move on. I think the results, as we all know, that those point prevalence surveys are absolutely irreplaceable in terms of identifying the local needs down to the facility level, down to the ward level, to really understand those gaps. Thank you so much for that. From the chat, there's a question I'll ask first. About feedback from the lecture series and follow-up with participants. Have you gotten any feedback about from the participants about how they are applying their knowledge, or would this be part of the ongoing feedback with the culminating course this year?
Yeah, I can just quickly answer that. We did get feedback. It wasn't very much practice focused just because of the scope of the lectures. I don't think it allowed too much room for, making it gaining or asking them to do those practical implementations quite yet. But we do plan to incorporate it into the course with the follow-up afterwards, and yeah, them sort of using the knowledge more.
Great, thank you. There's so many questions. I'm going to see if we can get through a few more before we have to close. One question is back to the national action plans. The question is, how much is there emphasis on governance in the national action plans? I think turning to our first panel.
So let's see. Thank you, Olga, for the question. Could you elaborate a little bit? This is the Ukrainian action plan. Yeah.
No. Yeah, thank you. Thank you for all presentations and exciting collaborations and studies and everything. I need to express something that we face And that is during the activity, everything goes fine. When funding or activity goes off, then everything is at square one. The thing is, we face that now with the Fleming Fund. I cannot explain how much frustration, and particularly for the laboratory quality, nevertheless. So the question, what I have, it's not actually question, it's emphasis on the governance. Even in South Africa, we have a problem because how to put that and take responsibilities and govern the AMR program. Not, it's a complex. It's not about only one side. We find that human side, for example, being very well articulated. But what about animal? What about environment? How to put all in equation? So the governance is something that we've been working now, and we find it's very lacking. At least I'm talking from the South African perspective, and that is also something to recommend for everyone in the future, how important it is, and not to, I know the situation obviously, but in a child, how important it is to embed it in a national action plan and to emphasize on that. And anyway, the WHO recommended that as a really priority in the new edition for GAP. Over to you. I hope that makes sense, Sonia.
Absolutely, and I mean you're right, and I think, as you say, the funding importance, and then as you say, the governance, and also someone here also asked about the different sectors. How do you find that One Health approach, even if it's written in an app, how do you make sure it's sustained? And I think this is also, we haven't been in that dialogue with Ukraine on specifically the governance of the action plan, and but in our original plan, we want to see how we can make this intersectoral collaboration, but it's been really the focus on more on the regional hands-on work to support hospitals and so on. But I think in the long term, that would be much interesting for us as well to see how we can learn from each other as well.
Yeah, certainly. So in a child, what does that mean is that even with the funding, even as small as it is, it can actually be addressed at that level. Because, for example, the people are more scared to put that under one umbrella than what is in reality. And everybody, anyone, when they talk about different field, different sector, they are absolutely of concern how much impact is going to be in a sense, how to put it in a collaborative way forward. So yeah, so that was something that we experience now and trying to sort out in our third actually NAP that we are due to do.
That's great. We're excited to follow your work. Thank you.
Yeah. Surveillance always been good. Yes. The rest, it's a question.
Focus on the good.
Yeah. So we are at the hour. If our panelists have just one moment for one quick combined question here, and then I think we have to unfortunately thank our panelists and adjourn. But there's a question, there are two questions that focus on similar aspects in Ukraine. One is about progress with the animal health sector, and one is about reaching nurses and other professionals in rural areas. If we have just 1 minute to talk about reaching rural or remote areas and engagement of the animal health sector.
Yes, I can answer that briefly. I think with the animal sector, we've had some discussions like within our team, but we haven't found a way yet to prioritize it in the work. Yeah, but with the other question was about the
rural areas,
the rural areas.
hospitals in rural areas.
Yes, I think that was also part of the point. So within the 50 nurses, we want to see a bit of a geographical distribution so that they're not just from one area or just from the big cities, to be able, to sort of have that.
Thank you so much. All right. Unfortunately, I think we could continue this discussion for a very long time. This has been a fascinating panel, and I think so much to learn from for cross-border and multi-sectoral collaborations in every region for AMR and IPC. Also, a lot that can be applied here for biosafety, biosecurity, and other disciplines where there is a need to align national strategies and plans and find tools and training that can be rolled to the facility level repeatedly, because as we all know, that's the challenge, right? It's not just today, it's tomorrow and tomorrow and tomorrow. So thank you for the examples that you have shared. Appreciate everyone's time, and I hope that this can be a beginning of many conversations. I'd like to ask you all to join me in thanking our presenters today for amazing examples of what works.
And thank you all for your attention and all questions.
Thank you very much.
Thank you, everyone.
And bye.
Bye.
Let's go make the world safer.
Bye.
Bye, everyone.
Good job, Julie. Bye-bye.
Thank you, everyone. Thank you. Thanks, Jules.
Bye.